Right, good morning, everyone. We should have all attendees that have turned up so far in the room. Welcome, everyone, to this North Eastern Yorkshire Healthcare Professions Graduate Employment webinar. I have been very specific mentioning our region there, because my name's Paul Gibson and I work for NHS England across the North East, North Cumbria and Yorkshire region, primarily on return to practice programme, which I can provide more information on at a later stage. And I also work for our careers team, hence being chair today with our fantastic guest speakers that I will introduce shortly. This session, I'll just give a quick overview and introduction. It is going to be recorded. Just to let you know, apart from myself and our guest speakers, there'll be no cameras or microphones on at the moment. And so nobody's details are going to be showing up on there. When we're doing Q&A sessions, I'm not going to give out people's full names so that anybody's details are being shared on this session. A copy of it will be sent afterwards, along with copies of the presentations, and we've got some additional career support resources which I will share. There is going to be time for Q&A sessions as we go along, and we're making sure we're doing the Q&A at the end in case you think of anything later on. So you can submit any questions in the chat, any queries that you've got, please feel free to put them in there. I've just also added that little caveat in there. We might need to take away some of your questions after the session, so please don't think we aren't going to address your questions. If it's something very complex, very detailed that we need to go away, we need to get another workforce lead specific to your profession, then that might be something we take away and come back to you with. We don't just want to fudge an answer. We want to give you as much information and support as we possibly can as well. Just another heads up, when you did the registration for this webinar, we're only using your details for any feedback or to share any updates, and the slides and the copy of the presentation and the recording on there as well. If you want to opt out for any reason, we've got our England Nursing North email address on there as well. If you're on this call as an allied health professional, don't worry that it just says Nursing North. That's our team box for the moment, team inbox. We're going to rename it, but it's just got nursing in there. It's for any healthcare professional in there, but you can leave us any feedback. You can opt out of anything using that address there as well. The other big bit of text I've got at the bottom of that session overview is basically just to say we understand that at the moment, whatever the healthcare profession, whether it's nursing, midwifery, one of the 14 allied health professional roles, we know that things are challenging at the moment. So we're here to support with advice and guidance and help, as are our guest speakers, to get your career started, to get your first professional role, to help you within that as well. So we're going to be chatting about work across different sectors, and primarily we're going to be focusing on local authority, social care roles, and all of the different opportunities and ways and where to find jobs in those areas there as well. But it was really just to give you a heads up that some of our guest speakers might not be in your specific profession that you're looking to start your career in. But we're going to endeavour to provide as much useful information and advice that's going to help all professions in these sessions. And we'll take away further feedback and guidance. As I say earlier, if you've got something really specific you want to know about your particular AHP profession or field of nursing or midwifery, please let us know. But it is a heads up that unfortunately, for time constraints, we couldn't get a representative of every single professional in here in this room at the moment in time. But we do have great guest speakers that are going to share as much knowledge and information to help any professional. So hopefully that's addressed some of the kind of feedback we had last time about focusing very much on specific professions as well. Okay, so moving on then, before I introduce our first set of guest speakers, just a quick heads up on the agenda of what we're going to go through today. So I'll be introducing shortly our guest speakers from the HCPC and the NMC, who are going to talk about the importance of professional registration and how that can really support you as your career progresses. I'm going to give a quick overview around the National Career Service, specifically in terms of writing applications, preparing for interviews specific to the NHS and healthcare. They've got some really good resources, free information and advice, and webinars that are separate to this one that I'm going to show you how to be able to join, and I would definitely recommend everyone to join in those. And then last up, we've got Anita, who's our principal occupational therapist and chair of the Yorkshire and Humber Regional Principal OT Network. That's quite a mouthful. And we've got a Q&A session at the end as well. And in between, if you put anything in the chat or you want to raise your hands, we will give you the opportunity to come on the microphone if you need to do that. But happy to take anything in the chat box for everyone as well. So moving on then, the NMC and HCPC, as I say, we're very pleased to have joined with us today to have a chat. First of all, I'm going to introduce Mark Brook, who's our Principal Regulation Advisor for Professional Practice with the NMC. And I believe, Mark, have you got some slides that you want to, are you able to, is it letting you share them?
I'm just going to try that now, Paul. See what happens. Bear with me. Let me know if you can see them. They come up? Super. Yes, good morning, everybody. It's really nice, Paul, to give me an opportunity from the NMC to come along and speak to you all today. Now, as you'll appreciate, we are a regulator of individuals. We're not in a position and will never be in a position to help you actually find a vacancy within the NHS or independent health and social care. But what I'm here primarily for today is just to talk through the NMC, who we are, what we do, and the purpose of registration and the importance of registration. So just a very little quick bit about me. So my name is Mark Brook. I'm a Principal Regulation Advisor and I work in the Employer Link Service at the Nursing and Midwifery Council. I've been at the NMC for just coming up for 13 years and have progressed through various roles at the NMC. So I have a good understanding of what we do as a regulator and how we support registrants, that's nurses, midwives and nursing associates throughout their career. So I always like to start off with, which I think is really important, is to show just how valued nurses and midwives are thought about with regards to the public. So each year, Ipsos Mori carry out a poll, and they ask the public, which professions do you have the most trust in? Who do you trust the most as a profession? And each year they produce this list. There's a long list of people, and I always just like to show the top 5 and the top 10. Now, it'd be weird if I shared these slides and nursing wasn't in there somewhere. So I just want to give you an idea of how, in what high regard nurses are seen by the general public. So in 2024, when this was last published, you can see that 94% of the public found the nurses the most trusted profession in the UK, quickly followed by engineers, doctors, professors, and teachers. So I think, but with that comes a great deal of responsibility. Nurses and midwives and nursing associates are looked up to in their local communities. People look to them as role models. So it's really important that both in your professional and private life that you maintain a good character, because it's the public that hold you in this high regard, and they have every year that since they were introduced into this poll, which for nurses was about 6 or 7 years ago now, and each year, apart from in 2023, you can see that dropped down to 88%, but that was the same for all professions. But this bounce back has gone back up to 94, roughly where it was previously. I just wanted to give you that just so you can see how important that you're seen by the public. And then also just to give you a bit of contrast and show you the bottom 5, which I'm sure doesn't sort of show any real surprises. Politicians, them and government ministers. So we kind of covered everybody within government in those 2. And then you've got the likes of advertising executives, journalists and landlords. And I think we've all seen we've all seen adverts where we're promised this cream will make you look 20 years younger, and then when we buy it, we see the real reality, and it doesn't really make a great deal of difference. And the same with landlords and private letting agencies. You'll see pictures of flats or houses that you go to view, and then when you walk through the front door, they look very different to the photos that were shared with you prior to your visit. But I think it's always good to show that, just so people understand the importance of being a registered professional and what it means to be a registered professional once you come onto the NMC register. You are held in very high regard by the community, and it's right that they do, because it's holding you in high regard that then gives them the confidence to come and seek your services when they're not feeling well. And that's one of the big things for us as a regulator, to make sure that we can ensure there's public confidence in the professions. So this is our purpose at the NMC. Let me just do that, move on. It's not going to move on. There it is. So it's to promote and uphold the highest professional standards in nursing, midwifery, and to protect the public and inspire confidence in the professions. And we do that through the work that we do with employers, the work we do with other organisations such as Health Watch and other public bodies, but also in the publication of the code. When you join our register, you will be bound by your professional standards, which come under a booklet which we call the code. And that's split into 4 priorities. That's prioritising people, practicing effectively, preserving safety, and promoting professionalism and trust. What I'd like to say about the code, because you may have heard stories very different to this. The code was published to support and guide nurses, midwives and nursing associates throughout their career. Many people might tell you that it was introduced so the NMC could hold you to account when things go wrong, and it's a way that they could remove your PIN and remove your registration. And that really couldn't be further from the truth. Yes, for someone to be referred to the NMC, then they had to have breached those professional standards, but that's not why they were introduced. That wasn't their purpose. They were actually there to support and guide you throughout your career. And if I would advocate and suggest that once you're on our register, if you're not on it already, that you download a copy of the code onto your phone or other device, or if you can, get hold of a paper copy, because I think it's something you should be looking at almost on a daily basis to help support you in your profession. The NMC have a new strategy building on the one we had previously, and we've only made it a 2-year strategy this time because there were a lot of issues that we needed to get right, certainly within our own organisation around culture. So we thought it was right just initially to have a 2-year strategy rather than a 5-year one, so we could concentrate on some important aspects in those 2 years. And it's ensuring that there's trust in the professions. So making sure that we review and enhance our regulatory tools. We're looking at our standards around advanced practice. We're also looking at revalidation and to make that process more robust than perhaps it has been previously, and make it fit for purpose and make it fit for today. And then also the same to review the code, because again, the code was last reviewed in 2015. And so some parts of it, I'd suggest are probably slightly out of date now. So again, it's about refreshing the code to make sure that it works for you and supports you throughout your career as a nurse, midwife or a nursing associate. I talked about the culture transformation. We're looking to become a more effective and safe and trusted regulator and employer. If you've seen the news over the last couple of years, you'll have seen that there has been some issues at the NMC around culture, and we really are committed to changing the culture within our organisation so it's a regulator that you can be proud of. Strengthening leadership, and we're modernising the NMC. We've also just very recently refreshed our values, and as you can see now we have 5 values, which are integrity, fairness, respect, equity and effectiveness. Just want to build on a little bit around what the NMC do. So these are our core functions. So we have registration, and that's where we hold a register of every nurse, midwife and nursing associate who are legally allowed to practice in the UK. If you're not on our register, then you're not legally allowed to practice in any of those 3 professions whilst working in the UK. You must be on our register to be able to do that. And I shall give you some numbers on that shortly. I've talked about the code and I've talked about the code and what the code is there for. And also we set the standards for education, of which you'd have had to make sure that you met during your 3-year midwifery or nursing course before you was able to graduate. We also assure programs within education, and that's both pre-registration and post-registration programs. We maintain revalidation, which is something you have to do every 3 years. So every 3 years you have to do a little bit more than just renew your be retained on the register. You have to renew your registration every 3 years, and you have to provide us with some evidence to show that you're still safe to practice, fit and safe to practice in the UK. And then finally, fitness to practice, which is the one that most people worry about, and that's should they be referred to the NMC as their regulator. As I've tried to say previously, only those most serious cases should be referred to the NMC, and that's really not just to safeguard the public and patients, although ultimately that's what it's there for, but it's also to safeguard you, so you're working alongside colleagues that you can trust and who are fit and safe to practice. Some of the things we don't do, so we don't represent nurses or midwives or nursing associates. That's what you've got the Royal Colleges for, and that's why you have unions. They support you should you have any employment issues with your employer, or in the very unfortunate event that you should ever be referred to the NMC. We don't have a role in funding of training or continued professional development. That doesn't sit with us. And we have no powers to regulate employers. The regulation of employers in England sits with the CQC, and in the devolved nations, so Northern Ireland, Scotland and Wales, they have their own regulators for employers. We don't regulate health and care settings or commission training places, but we work with all of those organisations within all of the 4 countries, so that we're all consistent in the messaging we put around what it means to be working in healthcare in the UK. I said I'd give you a little bit of data. So when I talked about that people are worried that the NMC are there to take your PIN, as of the 31st of September last year, we'd given out 860,801 PINs to nurses, midwives and nursing associates. That's how many people there are currently on our register. So when you join the register, you join a large number of professionals. In that year, you can see we received just over 6,500 referrals, which actually only equates to about 0.7, just over 0.7% of the register. So a very, very small number of nurses, midwives and nursing associates ever get referred to the NMC in any one year. And then if you look down in the bottom right-hand corner, you'll see that the number that are removed from the register was only 289. So the chance of you ever having your PIN taken off of you by the NMC is really, really, really tiny. It's really, really unlikely to happen. And so when things do go wrong, it's really important that you acknowledge something's gone wrong, you show some insight into what happened, and you show how you're going to strengthen your practice to make sure it doesn't happen again. Just a little bit of information that when you are given your PIN, this is what the PIN means. The first 2 numbers in your PIN will be the year that you join the NMC register. So if you join in 2026, that'd start with a 26. The next letter is the month that you join the register. So A for January, B for February, C for March, so on and so forth. The next 4 numbers are just random numbers to make it unique to yourself. And then finally, the last letter denotes the country in which you train. So E for England, S for Scotland, N for Northern Ireland, W for Wales, O for overseas. And when we were in the European Union, nurses and midwives in the European Union were given a C for the EU. Since Brexit, everybody that joins our register from overseas that's including in the EU, have an O at the end of their PIN. Just bear with me. Just quickly, last few slides. I know I'm sort of taking up a fair bit of time here. That's your journey. You're bridging that gap from being a student to being a newly qualified nurse, midwife, or nursing associate. So what happens when you join the register? So when you finish your course, your university uploads your course and personal details to our database and send us a declaration of your good health and character. Once we have everything for university, we'll send you a letter to let you know how to create your NMC online account. And it's really important that when you create that account, we have a current and up-to-date email address for which we can contact you, because when we need to send you reminders about paying your fee on a yearly basis, or when it comes to your revalidation, we will send those reminders to that email account. So should you change that, please provide us with a new one. You have 5 years to register your qualification from graduation, but if you haven't done it within the first 6 months, we'll ask for some additional information, and there is a link there when the presentation is shared with you to what that information is. If you just click on that link, it takes you to our website. If you don't register until after 5 years, then what you'll need to do is undertake a test of competence. And that's where you go into a test centre. There's a number of stations where you have to carry a number of tests to show that you're fit and competent and safe to join the NMC register. And if you pass that test of competence, then you can join the register at that point. And there is also some programs that you can also take at university that will help with that. But again, if you're not joining the register till after 5 years, please do contact us and we'll help guide you through that process. And I'm not going to talk through this last slide, but that can be shared, and it just gives you some information around that test of competence, or if you undertake that education program. I'm going to stop there because I've gone on probably slightly over my time. I apologise for that, Paul. But hopefully that's given you a little bit of information around us as a regulator, and also hopefully it's given you a little bit of assurance around if you're not able to register immediately because you're not able to find a role immediately. But even if you can't find a role, you can still register with us the moment that you graduate from university. And if there's any questions, happy to take those at the end of this session. And I'll hand back to you, Paul. Thank you.
Brilliant. Thanks so much, Mark. And I think that is the key point that Mark's made at the end there. We really wanted to impress on there the importance of registering for the NMC, and that even if you might not have a job right now at this moment in time or an offer, then registering is still really important, and all of the key things that the NMC can support with. And I think hopefully Mark's done a great job there. He has, for me at least anyway, of myth busting a lot of that stuff around, well, what's the NMC there to take away from me? Actually, there's a lot they can give you. And I think it's really key in those slides as well. We've got some of those great links, because the NMC website has a fantastic amount of knowledge, but it's really hard to find a lot of the stuff on there. So having just quick links to those key things about registration, what you need to do if you haven't registered within 5 years, keep a hold of a copy of that. We're going to make sure we send it across to you, because it's going to be really useful for you as well. There's nothing cropped up in the chat at the moment, Mark, but hopefully people can put into the chat, or at the end, if there's any issues with people adding information into the chat, you should be able to still raise your hands and we can make sure we can unmute your mic to ask any questions as well. So absolutely fine. If you want to have a think, you want to make some notes and ask stuff at the end, that's not a problem at all. We can come to that. So thanks again, Mark. Moving on now, we are delighted to have Vesna from the HCPC to discuss registration and CPD within the HCPC, if that's the regulatory body that your profession is going to be coming under when you're qualified very soon. So over to you, Vesna.
Thank you, Paul, and thank you, Mark, for this informative presentation about our fellow regulatory body. So my name is Vesna Maglov. I am a registration manager in our registration department in Health and Care Professions Council, HCPC, and today I'll be talking a bit about our regulatory function, about our continuing professional development, CPD requirement, in the context of our regulatory regulatory function. And we'll go through what CPD means, how to record it, what happens during the audit every 2 years for each profession, and with the intent of demystifying the process really, especially for newly qualified professionals, and to perhaps inform their decision of whether to join or not the register of registered professionals in this meanwhile. So next slide, please. So a little bit about the Health and Care Professions Council. We are an independent UK-wide regulatory body that regulate a wide range of health and care professionals, more precisely 15 health and care professionals, and our legal powers derive from Health Professions Order with the purpose of safeguarding the public. So very similar to NMC and other regulators. We are separate from professional bodies and trade unions. If yours is a regulated profession, that means that your title is protected by law, and to practice your profession, you need to be registered with your regulatory body. In my department, so just to mention that we also have our regulator, that is PSA, and we are accountable to them for the standards of good regulation. In my department registration, we maintain the public register of professionals, and we review applications for registrations, which are two routes, usually UK and international. We handle appeals, registration renewals, which I hear is revalidation for NMC equivalent. We assess a continuing professional development and provide frontline support to our registrants, applicants, and the members of public in general. So next slide, please. So a little bit about our standards and the register. We set the standards that professionals must meet in order to join and to remain on the HCPC register. These standards underpin safe and effective practice across all the professions we regulate. So first we have standards of education and training. If you join our register through the UK registration route, it means you have completed one of our HCPC approved programs. Graduates from those programs are automatically eligible to join our register because they meet our standards of proficiency. For international applicants, entry to the register is based on the individual assessments of their applications, and they need to meet the same standards of proficiency to ensure equivalence and consistency. We also have standards of conduct, performance, and ethics, which set out what public should expect from our registrants and also help us make the decision about their character and their fitness to practice whenever a concern is raised about the registrant's conduct. Today, we're going to focus on our standards of relating to CPD because these are essential for maintaining ongoing registration and fitness to practice. So next slide, please. Here, I just wanted to present all the profession we regulate. As a multi-profession regulator, we oversee 15 of them, each with its own registration fixed 2-year cycle and renewal cycle. Every profession is in renewal every 2 years. So-called renewal window begins 3 months before the end of the registration cycle. We open the so-called renewal window, and during the renewal window we randomly select 2.5% of that profession for CPD audit. The selection is random and the registrants need to be at that point on are registered for the whole duration of the 2-year cycle, so they had enough time to complete their continuing professional development, and also they should not be in any fitness to practice. Next slide, please. So just a bit about what that stands for, continuing professional development. Because most of our registrants work in a wide range of different settings, that can be clinical, non-clinical, a role in research, teaching, managerial, and so on. The CPD is about keeping your skills and knowledge up to date within your current or future scope of practice. This responsibility is on the registrants to make sure they're keeping their skills and knowledge up to date. And that is to ensure their continued fitness to practice, but also to ensure they're drawing upon their skills and knowledge, and that they continue to develop within their role. We have developed our approach to CPD to be flexible enough to take account of the wide range of different health and care professionals registered with us, as well as their different working roles, their different learning needs, and also variation in their access to actual learning activities and different types of CPD. And all that to, as I said, keep their knowledge and skills up to date. CPD is unique to everyone, so that you remain fit to practice. There is no one-size-fits-all approach. It is outcome-based. It's not about collecting points or hours. It is entirely self-directed and no requirements for any official sign-off. And next slide, please. So on this slide, I just wanted to present the main, the CPD standards against which every CPD profile is assessed against. So you must keep up-to-date record of your CPD activities, ensure your learning includes a mixture of activities, ensure your CPD contributes to the quality of your practice and service delivery, and ensure your CPD benefits service users. I hope these 4 standards are quite straightforward. Next slide, please. So the standard 1, to keep a continuous, up-to-date and accurate record of your CPD activities. The best advice I can give you on this, if you are selected for audit, you will need to see, we will need to see your CPD activities covering the 2-year period, registration period, and looking back over such a long period of time can be challenging, as we know, and that is why it is important to record your CPD regularly in whatever format suits you. That is essential. And this is just an example of how list can be maintained. There is no right or wrong way to record. Some may prefer using a CPD app. Some regulatory bodies I see offer CPD apps or endorse certain CPD apps. We don't. Others may use a simple Excel or Word spreadsheet, or simply keep a dated list wherever it is accessible to them. For us, any method that works for you is acceptable, and the list has to have a minimum really amount of details, something that serves you to remember when the activity took place, and the name of activity, just very high level of detail. Also, I should mention here that the only requirement we have when it comes to continuity of this list is no unexplained gaps of more than 3 consecutive months. So if you have a gap in recording or doing your CPD activities, our assessors would like to see the reason behind, which happens as well. We don't set any set number of hours, and we do not endorse CPD apps, as I said. It's all about you identifying your own developmental needs and choose activities that support you in your current role or future role. What matters most is the actual impact of your learning, how it is strengthening your practice, and how it is benefiting or will benefit your service users. Service users, we define everyone who benefits from your practice. So this approach gives you the flexibility to plan CPD activities that are genuinely relevant to your role and that are meaningful for your ongoing development. So this list just shows examples. I invite you to visit our website for more exhaustive list of examples and just more details on CPD. Next slide, please. What we find from our experience talking to our registrants is that they often do CPD but are not aware that something counts as a CPD activities. So I just wanted to present the main types of activities that count. As we defined activity, CPD activity, any activity that helps you reflect, learn, and develop your skills. You can meet this requirement through work-based learning, professional activity, formal education, self-directed learning, very important one for newly qualified professionals or those awaiting for employment, or voluntary work, shadowing, and so on. Next slide, please. So when you're selected for audit, you're also required to upload some evidence for the activities that took place. Usually it's 4 to 6 pieces of evidence and 4 to 6 examples. Evidence may include materials that are produced by you, produced by others, any evidence of your reflection on your work or your learning. For example, notes or any developmental plans. So the evidence should support the examples that you mention in your CPD. Next slide, please. So at each renewal cycle, as I mentioned, 2.5% of the profession is randomly selected to submit the profile. Selected registrants must submit their profile before the end of the renewal period, and profiles are reviewed by our trained CPD assessors who work in pairs and who are of the same profession as you on the same side of the register. Next slide, please. And this is just about a bit of logistics of how the CPD profile actually looks when you log into your profile and you are selected. So CPD profile includes a dated list of CPD activities, a word summary of your recent work. This summary of your recent work or your current practice or your future practice helps assessors to contextualize your profile and to see if the activities that you're doing are relevant to your practice. There is also a word statement on how you meet CPD standards. This statement should include not more than 4 to 6 examples and supporting evidence. Again, 4 to 6 pieces of evidence that support those examples. So we absolutely don't require you to think about every single CPD activities in this statement over the period of 2 years. And next slide, please. This slide is to show how newly qualified professionals can maintain still their CPD and continue developing even before securing employment. Useful activities include reading professional articles, journals, guidelines, watching webinars, online lectures, exploring new research in their areas of practice. Because self-directed learning is fully recognized by the HCPC as a valid CPD activity, as it can help learn and develop. Also, you can take part in a variety of other learning activities, as we expect registrants to undertake a mixture of activities, not only formal courses and not only in employment. Individuals can attend free online conferences, seminars, join professional bodies, participate in reflective discussions amongst peers, and so on. Reflect on learning. Newly qualified professionals should keep notes of what they've learned, how it may influence their future practice, and how it will ultimately benefit their service users. Reflection is a very important part of CPD and shows that learning is contributing to your safe practice. And also a very practical hint from me, keep up-to-date CPD record, whatever you do, even before your employment begins. Maintaining a simple CPD log is very important and will result very helpful. As I mentioned, joining professional body, but also voluntary activities if possible. Volunteering in relevant environments, shadowing more experienced practitioners, just taking part in professionals committees or groups. As we don't approve specific activities, we are not prescriptive about what you choose for yourself. Any learning, any form of learning contributes to your professional growth. And next slide, please. There's always circumstances where our registrants cannot complete or submit their CPD profile. We have an option of asking for deferral. Every deferral request is reviewed individually and in light of the circumstances for that particular person, and all the registrants who defer are automatically selected for the next registration cycle for the audit. We understand that sometimes there are circumstances that prevent people from actually committing to CPD as much as they would. Usual reasons are maternity leave, long-term sickness leave, family issues, and so on. And next slide, please. I will pop into the chat the main addresses where you can contact our team. One is for registration, another one is more particularly for CPD profiles. If you have any queries, please email us, and thank you for listening. I'll try to remain until the end of this webinar so we can answer any questions.
Brilliant. Thank you, Vesna. And yeah, I think it's really important to look at the similar things to the NMC in terms of a regulator, but also, you know, really interesting there. You're showing at the beginning the difference in the fact that you have 15 professions. I always say 14 AHPs, and I always forget the 15th as practicing psychologists. Massive apologies. But you've got the 15 very, very different professions there. So things like the CPD and the windows for registration are very different. So I think it's really important for our new professionals to know that. And once again, the support that you can offer there as well. It's about not just thinking about this is the regulator out to get me, it's what they can support with, and you can defer when needed and things like that. So I think that's really important. Thank you so much for going through that, Vesna. It's really important to acknowledge. And just from my particular quick little ending bit on that as well, just whilst the hands are up on the screen there, just to for the slide, that is, just in case any questions come through while people are having a think. I mentioned at the very beginning that I look after return to practice, so I work very closely with Mark and Vesna and the regulators, HCPC and NMC, and it is to acknowledge that obviously the importance of that registration and having that initial registration. If it does lapse, once again, we've got lots of support that we can offer and funding available for return to practice. And I do have a fact sheet with loads of information and links and our contact details in relation to that. if that is something that crops up for you as an individual, if you need to register and then step away and your registration lapses, it's fine. There's options and routes back to practice that we can support with, and HCPC and NMC have got their own individual processes, details to be sent out after this registration as well. Just on that point as well, I thought there was a really interesting question came in the chat from Adobe. Apologies if I've mispronounced your name there. Just saying, currently working as a healthcare assistant. Once I receive and register my NMC PIN, will I still be allowed to continue working as a healthcare assistant while I am seeking a Band 5 nursing post, or will I be required to stop working as a healthcare assistant? Really interesting question that pops up quite regularly. So Mark's mentioned that in the chat there. I don't know if you want to come on the mic and mention it, or you want me just to read out what you've put in the text just for the recording purposes, Mark.
I'm happy to come on, Mike, Paul. Yes, you can still continue to work as a healthcare assistant. Absolutely no issue with that whatsoever. But what you need to be aware of and just be mindful of, that you are employed as a healthcare assistant and not a nurse, so not to stray into that nursing role. However, because you are on the NMC register, you are bound by the code professional standards of practice and behaviour. So you'd still be expected to comply with those professional standards, even though you're not working in a nursing role. And I gave an example there that, if you were charged, cautioned or convicted of a criminal offence, you are under an obligation to notify your employer and us as your regulator. So even though you're not working in a nursing role, were you to be charged, cautioned or convicted, you would still need to tell us as your regulator that has happened in your most likely private life. And I put in there 23.2 of the code states what that obligation is. Doesn't mean to say we're going to do anything about it, but we have to be aware of everybody on our register who has been, say, charged, cautioned or convicted of a criminal offence.
Brilliant. Thanks so much for that as well, Mark. That was just in case anybody can't access that in the chat there as well. And I thought it was a really good question. And I also wanted to bring it up now as well, because I wanted to put Vesna on the spot with this one as well, and just say, if we flip that round for the HCPC registrant, say somebody exactly in the same situation as Adobe, for example, somebody working as a physiotherapy assistant, going to come on the register as a physio, what would the HCPC's take be on that? Are they still allowed to work in that physio assistant role?
Absolutely. Most of our registrants are not necessarily practicing under the protected title strictly. Their titles vary, and as long as they are using their skills and knowledge, they can work in a variety of roles, and they can remain in assistant role as long as they are maintaining their skills and knowledge, which is very possible, and they can prove that once audited, and if audited, that is absolutely fine.
Brilliant. Thank you, Vesna. Sorry for putting you on the spot there, but
No.
I just thought that was a brilliant question, to be honest. I think it's something that a lot of our about to qualify professionals are really wanting to ask, and Vesna's just popped a registration details in the chat as well. And for anyone watching the recording, I'll pass on the registration email there as well. So yeah, I think really thanks for that. I think it's really important to address that.
And if I can just quickly jump in there, Paul, so I didn't put it in there.
Yeah.
And what Vesna said just reminded me, actually, is that if you are working as a healthcare assistant, obviously that wouldn't count towards your revalidation, because it has to be working in a nursing role, midwifery role, whichever profession you're in. There might be some aspects of that role you could use in your revalidation, but you'd need to be providing evidence of working as a nurse or midwife to be able to revalidate at the end of those 3 years.
Yeah, brilliant. Thanks for that really important point to get in there about the revalidation and registration. But as we said, we're going to share those contact details as well. So if anyone's got those concerns, please pick up the phone or email the NMC or the HCPC and ask them those questions. They'll be more than happy to answer. You're not alone in being in those situations as well. So thanks so much for that, both of you. I'm just going to very quickly move on now, and once again, conscious of time, I want to give Anita as much time as possible. to do her guest speaking slot as well about working in local authorities in social care sort of roles as well. Just wanted to very quickly touch upon that mentioned in the agenda around the National Careers Service. So the guys at the National Careers Service, or NCS as I'll abbreviate it, very kindly give me these slides and said, in a past working life a long time ago, I actually used to work on the National Careers Service contract. So they said, Paul, you're fine doing the slides and signposting people. So when I mention National Careers Service, a lot of people are very unsure about it, or they just think it's for young people at school. National Career Service is an impartial, free information and guidance service, free to access for any adult across the country as well. They provide advice and guidance, information on careers and jobs markets in your region, information on training courses and funding available, different learning options, and also understanding your skills as well, which I'll touch upon again a little bit later, because it's great stuff for preparation for interviews and application forms as well. So yeah, free to access service. In northeastern Yorkshire and North Cumbria, our region, it's an organisation called Education Development Trust that run the National Service Career Service contract. So you'll see later on things that mention email addresses that are edt.org, and that's all that means. Education Development Trust, the education charitable organisation that run the National Career Service contract. So if you see those email addresses or websites, it's still the same organisation on there as well. So just a quick highlight in the way that they can offer support. Sorry, I think I've got to click on the slide again there to get those up. Once again, regardless of what your questions or queries are around how do I get into my particular healthcare profession, you know, that might be some of those short-term needs to get you back into work or into a profession that you're qualifying for. So loads of help with the job searching, getting advice and support with CVs, getting those sorted. Preparation for interviews, help with application forms. That's what the individual advisors are there for. So they do group workshops, they do individual one-to-one sessions, so they can be very specific and focused on what your needs are there as well. There's a lot of kind of assessment around skills and experience and personal strengths as well. So I always say to people, this is really useful, particularly if you're looking at slightly different job roles. So maybe you're looking to progress in a different job role. You might be qualifying as a physiotherapist, as I mentioned just as an example earlier on as well. You might want to know what other job roles that relates to, or where that could take you, specific roles. Maybe that would be, you know, setting up your own private practice, working in the NHS. You might be working for a sports team. So it's really to kind of highlight and assess what would be, you know, your options out there, and highlighting different roles related to your qualifications and your experience as well, but also looking at those longer term goals. Do you want to progress? Do you want to be a manager in the future? What other additional training might you need to do? What learning options might be good for you to do, if at all? Do you need to do other training qualifications? Is the funding out there? So they can help with all of those short term, medium and long term goals as well. In terms of the different offer that they do, face-to-face, out in your local area, you will have local community careers advisors, quite often in places like job centres, local libraries, different community hubs. They might go into colleges and sixth forms, so they're out there in your local area. But there's also the digital service offer, so the website on there, information on loads of job profiles. So once again, if you've qualified in a certain area and you want to put that profession in there, look at the job profiles. It'll also tell you ones that are linked. And bringing back to that question we had a few minutes ago, it'll bring up things like assistant roles, healthcare assistant roles. It might bring up where you could progress into management roles, what types of salary you might expect. And once again, help them setting short and long-term goals as well, where you go. So it's really useful for that. And it's a bit of self-directed research that you can do on there as well. Skills assessments, once again, identifying what your skills, what your strengths are, what they match and they fit to. Now, I always flag that one up, is that's really useful. You might have to do assessments. You might have to do a skills assessment as part of like an application process. You might be struggling how to discuss your strengths and skills in an interview scenario, once again, that's a really quick little free easy tool to do, to highlight where you're good at, where you've got areas of improvement that really help in those different scenarios. And once again, help with getting jobs, finding courses, that type of information, all on the website as well, which we've got the web address for on these slides as well. And very finally, the one reason that we wanted to share these slides and very specifically to you guys is I would absolutely recommend signing up to one of their National Careers online workshops. These are NHS applications and interview workshops, so very specific to what you guys are going to be doing and where you're going to be looking for job applications. Even though it says NHS applications, I would also like to point out it's going to be very similar process for local authority, social care, private independent voluntary healthcare organisations as well. So I would definitely recommend signing up and going to one of these sessions. I'll share the poster that's got all of this information on afterwards. So we've got them upcoming dates on the 17th and the 27th of Feb, 10th and 27th of March. All you need to do is either call or email that booking line at edt.org email, letting them know that you want to sign up for the NHS application workshop. It's going to be held on Teams. It'll be, once again, a confidential session, so it'll be done without people's faces, names on the screen on there as well. So similar to these sort of sessions, but very focused, about an hour and a half long on what to do, how to support with doing applications from the wide range of different roles as well. So it's not going to be focused on one specific profession. One thing to flag up as well is that your careers advisor that you're getting in contact with will ask you to register as well. So once again, it's free to register for these workshops. They're not sending on your information or anything like that. It just means if you need follow-up information or sessions, they've got your details. They can see that you've attended the workshop. Any queries you've got about your profession or working in the NHS or in social care or those types of things, that's all they're doing it for. So it's free and confidential, but they'll just get you to sign up so that you've got you set up as a National Career Service customer, a National Career Service client on there as well. But would definitely recommend that. We didn't have the time to do the full session today. This webinar would have took a very long time, but we've got those dates there, and I'll be sharing them afterwards. Anyone got any other queries on that, please feel free to pop them in the chat and I will address them by the end of the session as well. So handing over now, delighted to have Dr. Anita Mottram to discuss working in social care and in local authorities and her experience and hints and tips around that area as well. Over to you, Anita.
Thanks ever so much, Paul. So good morning, everybody. As Paul said, I'm Anita Mottram. So I'm Principal Occupational Therapist at Kirklees Council in West Yorkshire. And you'll have just heard about the professional registration processes that you are likely to have to engage with. What I want to do now, though, is to take the opportunity to promote why you could work in social care. So working in social care, we can undertake preventative interventions. We enable people to live improved quality of lives in their home of choice. We can prevent, reduce or delay the need for statutory services. And as practitioners, you would have the opportunity to work holistically, work autonomously, and to utilise a wide range of professional skills. So whilst my presentation has a focus on OTs, the information is transferable across other professions too. Next slide, please. Thank you. So workforce data has been produced by Skills for Care, and that identified a social care vacancy rate of 7% in 2024-2025. And this is quite a high figure compared to nationally. One of the reasons that we think this is that many students seem to think that they can't come and work in a local authority immediately upon qualifying because they've attended a HEI to complete their course. And usually, if we're honest, because most of the curricula is geared towards working in the NHS. And this is an incorrect assumption. We can offer job opportunities for newly qualified members of staff, and we can support them well through their preceptorship. So this slide just shows a map of the Yorkshire and Humber region. It's one of the largest regions in England, and there are 15 local authorities that would provide a range of different services that you can apply for. So give you plenty of opportunities in terms of seeking out a role that suits you. So at the moment, the national AHP strategy focuses on having therapists in the right place at the right time and with the right skills. And it's got a greater emphasis on early intervention and prevention to prevent hospital admission or health deterioration. So these are ideal locations to undertake that work. Each of these local authorities has their own vacancy site. So if you are interested in working in social care, what I would suggest is finding a local authority in the area that you would like to live and work in, and then sign up for these job alerts. And just as a bit of a narrative, a couple of years ago, I presented at my local university and I asked the second year students what councils do. The response that I got back was, well, you just license pubs and takeaways and fill holes in the road and nothing else. Trust me, we do far more than that. And the comment on the slide is actually mine. It's something that I wrote for a blog that I produced for the AHP faculty, and something that today I firmly believe in. Social care supports everyone at some point in their life, from birth to death. So we have an opportunity to work across age ranges. We break down barriers that prevent people living the life that matters to them. And we overcome disabilities that prevent people from participating in society and living independently. Next slide, please. So why would you want to work in social care? Well, this slide contains information about the National Adult Social Care Workforce Strategy for the next 15 years, which aligns with the Fit for the Future NHS plan. And that reinforces very much that need for investment in social care. It identifies that therapy services of the future will primarily be based in community settings rather than hospital settings. And these are the three core areas of focus. So from hospital to community, social care is community support. It provides assessment, planning, support services, coordination, monitoring and advocacy to enable people to improve their well-being and live the lives that they want in a place that they call home. To make the shift from the current very hospital-centric model, there is a need for investment in social care, and we need a skilled and well-trained workforce for this to work as we provide more predictive and preventative interventions. More community-focused interventions mean that we will require more therapists and nurses to undertake these. And this will provide us with greater opportunity to engage with families to prevent physical and mental health needs from escalating. And then we've got sickness to prevention. So we can provide support, therapeutic, nursing interventions for those with physical or mental health needs. Social care plays an important role in supporting people to manage their existing conditions or disabilities and to prevent further deterioration. And the workforce strategy aims to support the shift from sickness to prevention by promoting these models of early intervention to prevent people's situation deteriorating and to decrease the amount of time that people live in ill health. Within social care, we have the autonomy to support people by working with them within their own environment and at their own pace in a way that can't be replicated on a hospital ward. And then lastly, analog to digital. Within this plan, there's recognition of the difficulties in sharing information between services that are working with the same person. And there is hope that this plan may move one step closer to rectifying this. The move to digital will help people to navigate and access services, health and social care information. And we can use this as an opportunity to support more people at home through the use of telecare and telehealth, which means that people can be remotely monitored rather than having to be admitted to hospital. So whilst each of these three core areas cut across the adult social care workforce, each will have an impact on the future modelling of nursing and therapy services going forward. Next slide, please. Excuse me. So I just want to touch briefly on the principles of occupational therapy, because how can we achieve all that I've just said? So OT empowers people to do what they want, to live fulfilling lives, to enable them to participate in activities they value that offer meaning and purpose. We work with people to support them actually in their own home to access the community, education, leisure and work. We help people to live with multiple health conditions and to live well and to age well with ease for as long as possible. We also provide support to children to prevent learning needs from escalating, and we can work with contractors and architects to ensure that new build properties are designed to be inclusive and adaptable for people of all ages and a range of needs. And this slide just highlights some of the core skills of OTs, which contribute to how we can make that difference for people. So the next slide, please. Thank you. And the reason I provided a brief reminder on the previous slide of the skill set of OTs is because of the legislation that registered professionals work to within social care, which is the Care Act for adults over 18 and the Children's Act for those under. On this slide, you can see that the Care Act places emphasis on person-centred care. It's about listening to what people consider to be their strengths, their values, supporting them to identify what outcomes they wish to achieve to prevent deterioration and reduce their needs or delay the likelihood of state-funded interventions. Just reflect on the previous slide and the principles of OT practice, and bearing in mind that this is the primary legislation we use in social care. How similar are they? Is it any wonder that therapy plays such an important part of social care practice? Next slide, please. Okay. So, do you have the skills to work in social care? That's a question that only you can answer because not everybody does. Some people prefer to be part of a hospital department with lots of people around them during the working day. Within social care, you need the ability to be able to work autonomously, to manage your own caseload, and be out in the community in people's homes. Within social care, there is a real opportunity to work creatively and flexibly. You will take into consideration the physical environment, but also the cognitive, the psychological, the social, and the environmental. So it's a good grounding in holistic practice. Working in social care is not about a focus on time-limited interventions, and it's not restricted to specific solutions. It is one of the most strength-based, person-centred and holistic ways of working that I've ever come across. You will walk into a situation not knowing what you will be facing, so an ability to think on your feet and work autonomously is paramount. We need people who have the ability to have wellbeing conversations, to tease out what the individual feels that they need. And you will need to be able to create comprehensive and professional notes to document your decision making. These are perfect roles for those who like to enable and advocate for others. Next slide, please. Thank you. So as therapists and nurses, there are a range of roles that we can take on that complement our professional mindset and practice. What I would say is don't be afraid to look at roles that are not got that protected title. So then they don't actually state nursing, OT or physio in the title. You don't have to have this in your job title to be able to evidence that you meet your CPD requirements. And this table shows some of the roles in my local authority that a newly qualified practitioner can take on. So there's quite a wide range there. But as your career progresses, there are other leadership roles, such as senior practitioner, team manager, service manager, principal, either OT or social worker, and then also director roles further up the chain, which have more of a strategic leadership focus and are something to aim towards. Next slide, please. So once you've successfully applied for a role as a newly qualified graduate and started in post, your preceptorship year will begin, and in some local authorities, this is known as ASYE, or Assisted and Supported Year in Employment. Ensuring registered professionals have access to support during key transition points in their career is essential for successful professional development. And this includes joining the workforce for the first time, returning to work after a period away, including being readmitted to the register, working in the UK for the first time, taking up a new role, or moving to a new organisation. And preceptorship does this by providing a personalised programme of professional development opportunities with support from an experienced colleague to ensure that you achieve your potential as you transition within the workforce. The implementation of preceptorship should empower individuals to engage in their own development, and work in social care brings access to CPD opportunities as much as working in the NHS does. Next slide, please. Okay. So I just want to come back, if I may, to occupational therapy. There are around 3,400 OTs working in social care, so only a small number, but we do have an opportunity to make our voices heard. We've got regional network meetings for operational managers. We've got regional principal OT meetings where we look at strategic needs, where we look at service development, where we look at governance and national policies. But also we've got a national principal OT network of the regional leads, which I attend on behalf of Yorkshire and Humber. And that allows me to have close links with the National Chief Allied Health Professions Officer, Suzanne Rastray, and also the Chief Social Worker, Sarah McClinton. And I meet regularly with them. And this allows for the voice of social care to be heard at the Department of Health and Social Care, and for us to contribute to the development of any policies and guidance, for example, the Intermediate Care Framework and Proportionate Assessment Guidance. We also regularly meet with the Royal College of OT and contribute to the development of their work, such as the recent update of their Care Act documentation and the publicity material that will be shared to promote this. Next slide, please. So what are the benefits of working for a local authority? Well, as you just heard, there is an opportunity for your voice and comments to be heard nationally. There's a slightly shorter working week than working in the NHS, so 37 instead of 37.5 hours. And you need to be aware of this when looking at salaries, as obviously you will be paid slightly less for working less hours throughout the year. Many local authorities allow their staff to work flexibly in a hybrid model, with time spent in the office and other time working from home. This doesn't suit everyone, as you need to be able to work autonomously without people around you all the time, and to be committed to undertaking the work. You may choose to work the hours under an annualised model, for example, just working in term time, so that you can spend school holidays with children if you wish, and if this is agreed by the service. But also, some local authorities offer discount on things like transport costs, buses, trains, parking, discounted gym membership at local authority sports and leisure facilities. There are also discounts with local and national retailers. And your employer would contribute to a defined benefit pension scheme so that when you retire, your pension is based on your final salary. For those of us of a certain age, then it's helpful to be assured that you know what pension you will be getting when the time arises. And this also provides financial protection should you need to retire due to ill health. From a CPD perspective, we've got a range of in-house learning and development programs which cover a variety of needs with the opportunity to source external training if there's not a suitable in-house course. You'll also be able to access NHS courses free of charge. And for example, I've recently had 2 staff members who completed a postgrad certificate in professional leadership that was funded by the NHS. From a practitioner perspective, there is a joy in supporting people in their own homes to enable them. And you can be involved with people for many years and build up a strong working relationship with them. Next slide, please. So why not consider a career working for a local authority? On this slide, I've just provided a list of websites that you may wish to use to seek some more information about joining us. This includes what it means to transition from a student to preceptee, or if you're undertaking the return to practice route, to review any changes that might have taken place since you last practiced. We've heard this morning about the HCPC and NMC professional standards guidance, and I would advocate you make sure that you are working to these, but also to consider joining your professional bodies as well. So from my case, the Royal College of Occupational Therapists. And then lastly on this slide, I would advise you to sign up to job alerts for the local authorities that are shown on slide 2, so you don't miss an opportunity to hear about vacancies. And I've also on this slide added some additional job sites that advertise council's roles. Next slide, please. So if you do decide to apply for a role working in social care, I've just included on this some useful reading material that might help you in preparing to complete your job application and to prepare for interview. Next slide, please. And so that concludes my presentation. Thank you ever so much for listening today. And I'd just like to open it up now for any questions if you have any. Thank you.
Fantastic. Thanks, Anita. Yeah, I'll just, whilst we're waiting for anyone to pop any questions in the chat, or like I say, stick the hands up again as well. We don't expect you to disclose any personal information if you want to put your hands up, but if you want to come on mic and ask a specific question, that's absolutely fine. Just wanted to say, yeah, I think Anita's fantastically there. Obviously, as I mentioned at the beginning, an OT by background, but is really laid out there about local authority social care, those skills, experiences, working patterns, how to apply for jobs, what the job looks like, what practice looks like. I think she's done a great job there of talking about how they would apply to a myriad of professions. You know, I've got a family who work in social care, mental health practitioners, nursing, and I would absolutely say within local authorities or social care that everything she's talked about there applies, and including, just to pick up the last little bit around useful websites, looking at the different areas in Total Jobs, Indeed Jobs, local authority websites. Anita's flagged up there. I've also compiled a big list that I'm going to give to you as well. It's not exhaustive, but for example, just with Anita doing a great job of advertising our lovely neighbours in Yorkshire, I'm based up in the Northeast. Northeast Jobs is a website you can sign up to, and I think Anita flagged up really well on the slide there about setting up for job alerts. Northeast Jobs is one we've got with the other combined local authorities, so you sign up on there, and you know we've got Gateshead, Newcastle, Sunderland, Middlesbrough, all of the local authorities. You can find all of the jobs in one kind of one website there, so that's a really good one. And then there's other ones for different areas of Yorkshire and Cumbria that we've got on there as well, so I'll share that afterwards. But I thought that was a really good point of, yeah, recognising where to apply for the jobs, and they're advertised in slightly different areas than just sort of NHS jobs and some of the traditional ones you might have been looking at as well. So I can't see anything in the chat at the moment. Can't see anybody's got their hands up at the moment. Just give it a few more minutes in case anyone's thinking there while we're doing that. couple more slides. One that I wanted to flag up to all of you, that in case you're not already, my colleagues Stuart and Jordan have been fantastic setting up our newly qualified registrant transitional support program. And basically what this means is you can just fill in that form on the link when I send it out to you, and sign up to be on our newsletter. And those guys are sending out regular emails with information if anybody's flagged up to us any jobs that are out there, so we can go, here's some vacancies to apply for, any other webinars, training opportunities, anything else coming from NMC, HCPC, local authorities. We're putting that out there as well. And once again, you can flag stuff back up to us and ask any questions, get us emailed as well. And I can see a couple of questions popping in there now. Flagging up on the screen there again, that's our regional NHS England inbox for all healthcare professionals. So anything you think of afterwards, and you think always happens to me, oh, by the way, I meant to ask that, just pop us along an email and we'll get out and answer that to you as soon as possible. Just noticed in the chat box, Billy has popped in a question saying, why are newly qualified nurses struggling to find jobs lately? Billy, to be perfectly honest about that, there's a lot of vacancy freezes across region and across the country, I'd imagine as well. I don't know if Mark might have a better idea of all other regions, but from what I hear, it's across other regions, and I think we are really just waiting for a lot of those new vacancies to sort of open up at the moment as well. But as we're trying to mention one thing I would say is that if there might not be anything out there in your local trust, look out in things like social care as well. We actually had a few social care providers email me last week saying, we're actually looking for nurses, we've got jobs, can we send out the information? So we've got some of that stuff we're going to send out as well. So you might not have thought about that as your first step on your career ladder as a nurse, but have a look out there for some of that stuff in social care and some of the private, independent and voluntary organisations as well. We're going to be running a couple of webinars later this month on those as well. So Billy and anybody else nursing looking at that, look out for those webinars, because we've got other people that are going to come and chat about where they've got vacancies that are not necessarily within NHS trusts at this moment in time. But definitely going back to what Anita said earlier on her slide, flag up for job alerts for any of these job sites, including NHS jobs. If something comes up and a lot of people apply for it quite often on NHS jobs and other job sites, they might pull it if they get a lot of applications in. So make sure you've got those alerts so you're flagged up really, really early on to get any applications in for those would be my advice. Annabelle's also asked, I've noticed when applying for jobs, they advertise that they accept newly qualified. However, on the eligibility criteria, it will ask whether we have our PINs. When we select no, it automatically shares we are not eligible. How do I get around this? I don't know if anybody from NMC or HCPC or Anita wants to jump in on this one.
Yeah, thank you, Paul. Annabelle, I completely agree with you. It's frustrating, isn't it? It's frustrating for us when we are trying to recruit that this actually happens. Usually what we can do is if we notice that it has happened, then we can advise HR, our recruitment team, to actually disable that function on the system. So it may well be that the organisation that you're applying for doesn't actually realise the IT system is doing that. What I would suggest is if there is a contact number for the person who's actually recruiting, to just give them a ring and let them know that that's happening, please, because then they can have a dialogue their end and make sure that your application is accepted. Thank you.
Yeah, if I agree, Anita. I was going to say if there's a telephone number, then it'd be really good to contact the employer or the people that are advertising for those roles. I think one of the things you might find, Annabelle, within that is that if you haven't got your PIN, and employers may be worried that you could go through that process and then not actually get your PIN for any reason. So it might just give them the reassurance that you are on that particular register at that time, or you will be on the register. So that's the only reason I can think that might happen. But I think perhaps a telephone call can perhaps sometimes open that door to allow that application to take place. And just on your other point, Paul, recruitment issues aren't just in the northeastern Yorkshire region. They're across the whole of the UK and across all professions. It's not just nurses, but it's also the same for midwives as well. We hear this regularly in our conversations with chief nurses across the UK, that they realise that some students will be struggling to find roles, but I think it's also a matter of, as you've said, Paul, is expand your search. Don't just think about NHS in your region. There may be opportunities in other regions, and especially in social care and potentially even in primary care in some circumstances. So just perhaps widen that horizon a little bit and don't concentrate on one area, because it may be that you can find employment in a different area for now and then eventually move into an area that actually you'd prefer to be in the future.
Yeah, cheers Anita and Mark, and just a nice little plug for Mark there as well, that one of our webinars is going to be about primary care work opportunities, so thanks for that, Mark. I owe you a tenner for doing that. So yeah, so keep an eye out for the other webinar links that we've sent out. The one that you registered for on this one, I'm assuming it's come from the post that we sent out. You'll see that there's the other two webinars. I think the 18th and the 25th of Feb we've got on those ones. What I would actually just give a shout out to everyone about as well, if yourself or any of your peer group are interested in these webinars. I've had a few people emailing and saying, oh yeah, we really want to come, but we can't make that time. Please still register, or encourage any of your peers to still register for it, because then that means I've got your email address. I can send you the recording and everything afterwards as well. So even if you can't make it, still register for them as well. Or Adobe's asked, will you pop them in the links in the chat? Yeah, another good point there. I'll pop the links in the chat in a minute as well. Yeah, and like I say, just please register for them, even if you can't attend at that time, so you can get the recordings as well. Vesna, was there something you wanted to come in on that point as well?
No, actually, Mark already covered that. I just wanted to mention that we advise our applicants, future registrants, not to undertake any job commitments while waiting for their registration. So from the moment when they apply for registration, our registration processing times is usually 10 working days for UK applicants. But sometimes for the employer, that is not a guarantee that the registration will happen during that time, so they're reluctant to, especially I wanted to say, if the job advertised is under the protected title. For that kind of job, the employer needs to employ someone with the current active registration.
Yeah, good point. Brilliant. Cheers for that, Vesna. I've just popped in there. I'm just checking those links definitely work. Yeah, the other two registration links are in there if anybody's interested, or please share them round, as I say, with any of your peer group on there as well. I can't see any other hands raised or any other questions. I think we've timed that perfectly. We're given an hour and a half there. Rebecca says, thanks so much for your time and informative webinar. Thank you so much, Rebecca. Really glad to hear that you've found it really useful, because once again, with all of these things, we're here to support. We'd like to give you as much information as possible, but we're always time limited. So let us know any feedback of anything else that you think we could add in or improve or share with you afterwards. More than happy to kind of pick up any other information and any other additional stuff that we can share around as well. So yeah, I think that's everything, and all questions answered as of now. I don't know if our guest speakers have any other final thoughts, other than for me to thank you all massively for attending and for sharing your knowledge.
No, nothing more from me, Paul, and thanks for inviting us along today.
Yeah. Thank you.
Just to say good luck, everybody, in your job searches, and fingers crossed that something will come up that you will enjoy and have a long and fruitful career. Thank you ever so much.
Thank you. Thank you, everyone. That's the end of the webinar. Details, as I say, up on the screen, will be shared afterwards as well. And please get in contact if there's any other queries or questions that you've got in the future. Thanks very much.
Bye now. Bye.